All right, the doctor is in because we're talking about Expo, which is coming up this weekend. You're going to be there again with the daVinci machine, right?
Yeah, great. Thanks for having me. Yeah, we're bringing the daVinci back to town. We have the traveling version that's coming in on Friday night. We're going to get things set up and be ready for a day of action on Saturday.
Okay, what can you do with the daVinci?
So what we have going on is the traveling version of this. So the company is great enough to come by and set up a model of this. And what it enables you to do is get to basically look right into the operating room. So you get to see the whole setup right there on the floor, get to be hands-on with it. We're going to have a training module like we did last year with some games and exercises. People can sit down and actually go through some simulated cases. We're going to try to organize a little event and see who can run through some skills activities the quickest and see if we can generate a little bit of hype here.
Now, the daVinci you've had at the hospital for how long now?
Just over a couple years. We're coming up on 2 years. And it's been really successful. We're using it about 3-4 days a week now.
Wow.
Dr. Zucker and myself have really, the teams come together nicely. Everybody's trained. We're using it on call and, really making the most of it here.
Now, what's the advantage of having this versus traditional surgery?
So with the robot, what we have is a return to 3D visualization. So we're doing laparoscopic surgery, so minimally invasive through small holes. But what it enables your surgeon to do is just use fancier instruments. And if you come down to Expo, you can see how sophisticated these little tools are. They basically have wrists like the human hand and can do a lot more in a very small space. And that all translates to less pain and a faster return to activity.
And what kind of surgeries are you doing with the daVinci? What's your number one?
Yeah, so as a general surgeon, Dr. Zucker and I, we like to specialize in hernia surgery. That's one of the big things we like to do. It also really excels in just working in difficult areas. So doing big colon cancer operations, we're averaging about 3 days out of the hospital. Doing the basic stuff, appendix, gallbladder, those types of things is nice. Foregut surgery, so we're doing a lot more anti-reflux things this year. We're going to be bringing some new anti-reflux options to the community soon.
Okay. Now, as far as hernia goes, hernia is like organs pushing out, right? Is that what that is?
Yeah, essentially it's any hole in your abdominal wall. And there's common areas where that can happen, both at your belly button, the groins in men and women, anywhere you've had an incision in the past.
Yeah.
And it's where one of those weak areas opens up and allows the things inside your belly to go through your abdominal wall.
And then hernia, you have to get operated on. It just doesn't go away.
No, hernias don't typically go away in adults. And, there are certain risks to having them. They can certainly get bigger and they can get stuck. And that's one of the emergencies we want to try to prevent by doing an elective operation.
Okay. And you have a screening coming up soon, too.
We do. So after the Expo, which is next weekend, we're going to do a hernia screening on April 13th at Claxton-Hepburn. That's going to be at 10 o'clock. And you can call to reserve an appointment if you think you have something bothering you and you want to get checked out for free. You'll be able to come down, check out the robot. We'll do a little show, and we'll have a chance at that event to examine you and talk about whether this is something that we can fix for you.
Now, what's the number one sign that a hernia is something you may have?
Well, you'd be surprised. People typically know they have a hernia. They kind of feel a bulge. They feel, they have an event in their past that they said, oh, yeah, I was lifting that big piece of wood and just kind of felt something pop.
Right.
And so a lot of people really know that they have this. But, the groins, the belly button, anywhere you've had an operation is a weak area. And so if you're experiencing pain at that area that's new or you're feeling some sort of bulge that you can kind of push in and out, that's usually a pretty good sign that you got a hernia. And that's something we can look at.
Okay.
To reserve an appointment at that hernia screening, you can call Michelle Catlin at Claxton-Hepburn. Her number is 713-5251.
Okay, it's going to be a good time at the Expo and then the hernia screening, too.
Yeah, we're looking forward to it.
Thanks for coming in.
Thanks for having me.